We can be the difference. You're going to learn things you never imagined learning. You're going to learn how x-rays are created. You're going to learn the physics of x-rays and every characteristic of x-rays. You're going to learn the science of this field. Once you start the program, it's exactly 2 years long. Students usually take a little longer because they want to get, there's 4 prerequisite courses. Also, you get more points if you've taken care of like the core curriculum like English and math and communications and things like that. So generally people spend 2.5 to 3 years completing the program just for that reason. But students like to come in and have the core curriculum done because then they can just concentrate on the radiography courses and keep their focus on that. When you start the program, we have an orientation course where we're preparing you to go to the hospital environment, and then you learn your beginning positioning. Through the first year, you're learning positioning and anatomy, and again, the nuts and bolts of how x-ray works, the physics of it, how we expose images and the images created, for example. And then during your second year, you learn more advanced things. You'll learn a little bit about cross-sectional anatomy, specialized procedures, and ultimately pathology before you finish. Review and preparation for the board exam is built into the program. So when you're completed, you don't just start getting ready for your board exam. During the entire second year, we're trying to help prepare you. It's a 200-question exam in general, and basically if you pass that with a 75% or better scaled score, then you will become a registered technologist in radiography. And then that basically is a national test, so it counts everywhere you go in this country. It's a great marriage of patient care and technology, and if you like working with technology, but you also like taking care of people, this field's a great marriage of those things. There's something for everybody, whatever your personality is. If you like working in an environment where things are unscheduled and there's lots of great surprises, you can do general rad, you can do trauma imaging. If you like being in more of a scheduled environment, mammography, MRI may be for you. If you like surgery, you can be in surgery. You can be in a hospital, you can be in a clinic where it's a little bit more low key. There's just a lot of different environments, and people need to know that they can grow in a field and go on and do things like CT and MRI, or they can stay where they are, or they can just be in a lower paced environment or a high-paced environment. If we're great people, then we can have a great program. It starts with everybody who does the work here. We care about creating a culture. We care about knowing our students. We care about our students being more than a number on paper. And we care about their success ultimately.